Well, good afternoon all, and welcome back to Obong University's YouTube channel. Today we have with us Obong University's medical doctor that is going to be shedding some more light on mental health. Thank you. Please introduce yourself.
Okay. I am Dr. Timothy Akpan. I have about 15 years experience in practice, more than 12 years of those 15 years in university health services. And I've been privileged to see a number of students with mental health problems.
Okay. So what are the most common mental health issues you see among university students?
Well, I can easily pick out four, not necessarily in any order of prevalence. One is substance abuse disorder. Second one is anxiety disorder. The third one is bipolar affective disorder. And then the last one is psychosis. I can say something briefly about each of them. Substance abuse disorder can also be called substance use disorder. And it has to do with the use of any substance. Could be drugs used by medical people. Could also be other substances used for recreational purposes. But any of these substances that are used not for medical purpose and is not used according to prescription by any doctor or medical practitioner, use of such substances is considered an abuse. And it can lead to very disastrous consequences. One would be the effects of the substance, which can vary from making the person behave abnormally, making the person think abnormally, and making the person to endanger himself or others. It can also even lead eventually to the person craving to the substance, becoming dependent on the substance, meaning that the person may not be able to cope without taking the substance. It may also even lead to withdrawal symptoms, meaning the person will have untoward symptoms, undesirable symptoms when he stops using the substance. And so it leads to a web of complications or mental health problems. The second one, the anxiety disorder, that one is a problem with the emotion. And it is characterized by extreme fear, irritability, anxiety about, maybe it could be general anxiety disorder. It could also be to specific things, like what we call phobia. Maybe the person may be afraid of closed space, may be afraid of fire, may be afraid of water, may be afraid of heights, or the like. And it could also be what we call a obsessive compulsive disorder, when the person becomes pressured to be doing a certain thing repeatedly and becomes so nervous if he doesn't do or repeat that particular act. Then there's another one called post-traumatic stress disorder. Maybe somebody has a terrible experience, trauma, but thereafter the person is not able to cope. The person becomes nervous, agitated whenever he or she is exposed to something similar. For instance, a case of rape, maybe a lady was raped, she may become apprehensive at the sight of any man, as if the person is coming to rape her again. Or even the memory of the traumatic event may now bring back a replay of what happened during the traumatic event. That could lead to a very serious level of anxiety that can affect the person's normal, activity or performance. Then the third one, the bipolar affective disorder. That one has to do with the mood of an individual. Like we said, bipolar, that's two poles.
Yes.
It could be at either extreme or even in between, mixed. One extreme is depression. When the mood of the person is down, the person becomes withdrawn, lost interest in activities. The person becomes so sad. The person may have suicidal ideation as wanting to kill himself, feeling hated and all of that. Then the other extreme, which is mania, is when the person becomes aggressive. Everything is increased, activity increased, cannot sleep. The person feels pressure to talk. The person has everything abnormally high or elevated. That is mania. Then the last form of mental disorders is the psychosis. That one is like the extreme form of mental disorders. Example of psychosis is schizophrenia. That in psychosis, the patient or the individual is out of touch with reality. He doesn't even understand what is happening around him or what he's even doing. And the person may have two most important features the person will have will be problem with their thoughts, delusion, where the person may have a very fixed belief that this thing is this, even when that is not true. No matter how you try to convince him, he will not accept that what you are saying is true or real. He believes in a particular wrong thing, which every other person knows to be wrong. That is delusion. Then another characteristic would be hallucination, which is a disorder of perception. The person may perceive or see or hear what other people cannot see or hear. So it could be verbal, as in voice, maybe a sight of an individual, sight of something that every other person around may not be able to see. So these are the common forms of mental illnesses that we observe among students.
Okay, sir. Thank you very much for that. So how can students observe the symptoms of the anxiety, in conditions like anxiety, depression, or stress disorders in themselves?
Okay. I would say that there are features that is common to most of these mental illness or general features. There could also be specific features. There's features that are specific to each of the different conditions. And some may not be easily spotted by non-practitioners, non-medical practitioners. So the doctor, the general purpose doctor, or a mental health physician may need to use his own experience and knowledge to be able to identify some of those features. So I may not want to bother about those, technical features, but the general features that any individual can spot out, even the person affected can even notice it himself, will be when there is a marked deviation and abnormality in the person's thinking, in the person's mood, in the person's behavior that is persistent and it is affecting the person's, normal routine and normal life. That can be observed to be a sign or symptom of a mental disorder.
Okay.
For instance, let's take the first one, the substance use disorder or substance abuse. When somebody begins to take a particular substance, and this substance is not taken for a medicinal purpose, but for whatever reason, maybe to feel high, to feel excited, or even to escape from maybe problems or reality, then you discover that over time, the person becomes overindulged in the thing, keeps using the thing, that is an obvious indication that there is a mental health problem. And in that case, substance abuse disorder. It will start like the person that doesn't drink, beginning to be drinking heavily. In fact, by the time the person is still having insight, he will be able to know himself, that he's taking more alcohol than he should. Then others may also observe. Maybe somebody that was a teacher to life, or somebody that doesn't drink, beginning to be drinking and drinking. Of course, that is a first or early sign for anybody to know that there's trouble. Then at a point, when the person becomes dependent, he wakes up craving for the drink or craving for the substance. That is also an indication that there is a problem. Then there could also be a point that abnormal behaviors, maybe as a result of the effect of the substance that the person is abusing. So the individual himself may even notice he's becoming more agitated, his behavior is becoming confused. Then others may also observe these changes. So that is how one can spot like substance abuse disorder in an individual. If it is anxiety disorder, the individual can also notice that he himself is becoming agitated or nervous in situations that he shouldn't naturally be. Like panic attack, the person becomes kind of agitated at a sight of something or exposure to something. The individual himself affected may also spot that. Then others may also observe that in individual. So that noticing any deviation in the behavior, in the mood, in the thinking, the reasoning of an individual by others or by the person, that is a way to identify a mental health problem. Then if it is bipolar affective disorder, of course, others, the individual may not even know, but others may see somebody that is, talking a certain beyond the way he uses to talk, or somebody is shouting, is insulting people, is aggressive. Somebody that usually is very quiet is aggressive, having some anti-social behavior, cannot sleep. Those are very glaring, signs and symptoms of mental health disorder in the individual. So in summary, whenever there is a deviation from normality, what is normal in an individual, then one can now spot that to be a subtle change in an individual as a mental health disorder setting in. But once it gets to a level that even others can observe, the individual will observe it first, but others will also observe. To really make a final diagnosis, it is the medical person that should be able to now interact with the person and get more information and assess the situation and evaluate the patient. Then one can say the person definitely have a mental health problem.
Okay. All right then. So we have to watch our friends so that in case any subtle change in their behaviors and characters. Okay, it's understood. So what are some coping mechanisms or other preventive measures some people can take or students can take so that they can hold up these behaviors?
Yeah, fine. It's actually good to prevent a problem than to treat the problem. Yes. So when it comes to mental health problems, the best is to prevent these conditions from setting in than to manage them and to treat them, because most of them may be very difficult to treat, to manage. In fact, like bipolar affective disorder and psychosis, the patient may need to be on drugs for life. So it is better to prevent mental health problems than want to treat them. And I want to summarize the coping strategies or preventive strategies in 2 sentences. Number 1 is you feed or you nourish your mental health. Then number 2 is to protect your mental health. Now, how do we feed or nourish our mental health? Well, what we put into our brain will result in what we think, and what we think will result in what we do, and what we keep doing will become a habit, behavior. So if you want your mental health to be healthy, then you must feed your mind with positive things. Because these positive things you feed your mind will mold your mental health. And that means reading books that give you, positive ideas, mold your value system, improve your confidence, improve your ability to deal with problems and to succeed in your task, to organize yourself. So all the information you get, maybe from books, from lectures, from interaction with people that are healthy, that have healthy things to feed your mind with, and then even your church, because these are agents of socialization. So when we surround ourselves with positive agents of socialization, we expose ourselves to positive agents of socialization, then we'll be able to keep our mind healthy. So a good support system, social network of friends, responsible mentors, elders that we look up to, religious leaders, these are the motivational books, and we will be able to build our mental health in the positive direction. Of course, when we talk about health, we have the physical components of health, we have the mental, we have the social. These are interrelated. So the physical health is also to be taken care of, because if you don't take care of your physical health, then your mental health can also be affected. So that means having adequate rest is important to deal with stress. Having a balanced diet, keeping yourself healthy, relaxation, and all other activities that promote good physical health will definitely also promote good mental health. Then the second thing to do is to protect your mental health. Now, how do you protect your mental health? When you know the things that can hurt your mental health, that can damage your mental health, then you prevent those factors, those things from influencing you. Then you'll be able to protect your mental health. For instance, substance abuse. We know the substances that can result in substance abuse disorder if you use them. So the number one thing is to avoid even trying to use them. Because when you start using them and you become addicted, then you are on your way to damaging your mental health. So alcohol, cannabis, all the plenty things that people do or take. So we try to avoid them, and not just avoiding them ourselves. We try to avoid the company of people who patronize those stuff, because they say, "Show me your friend, and I will tell you who you are." So if you are associated with people that smoke, for instance, that drink heavy alcohol, you will likely want to be pressured into doing them. So you be careful that you don't have friends or you don't keep company that will influence you to doing this thing that will hurt your mental health. So that can help in preventing substance abuse. Another thing is stress. If you can manage stress, because mental health problems, one of the risk factors is substance abuse, which we mentioned. You have to avoid them. Then stress is also another risk factor. When some people are unduly stressed and they are not able to cope, they'll get to a break point where they will now start having mental health problems. Apart from the other one, genetic predisposition as a family history, which you cannot do anything about. But stress and substance abuse are things we can do something about. Yes. So one will also try to manage his life to avoid undue stress. There are a lot of things to do to avoid undue stress. Organize yourself, good planning, set right priorities. You don't need to set unrealistic goals and then get pressure. When you organize yourself, you know how to plan your activities and do things in time so that you don't get overburdened and then you become stressed out. Then when you also have positive reasoning, how to rationalize and know how to cope with problems, that okay, there's hope that things can work out. These are the things you can do. And you have a good social network of friends that can support you, or adult that can support you to deal with any particular situation. Then you'll be able to cope with stress and you'll be able to manage your time well, manage your activities well, and the chances that you become unduly stressed will be very slim. Most importantly, I want to emphasize the need to seek professional advice. whenever any individual feels that he's not behaving, he's not thinking, or his mood is not okay, that there's something wrong with him, or when other individuals observe that there is something wrong with somebody's behavior, somebody's mood, and anything about the way the person is going about living his life, it is good to draw the person's attention and advise him to seek medical help. So either the individual himself, knowing that he's not feeling quite okay in any aspect of mental health that we've discussed, it's good to seek medical advice. And the first port of call may be a general purpose practitioner. And if the general purpose practitioner feels there's need for further evaluation by a specialist, a mental health physician, what we call psychiatrist, then the person can be referred to a facility where such expert can be consulted. Then some people, when in the extreme that they really manifest overt symptoms of mental health disorder, such ones should be taken immediately to a mental health physician for help. Because you may try to manage the situation yourself, but you may not be able to do it perfectly well, and the individual may still be suffering some residual features of the mental health problem. But with a specialist, you'll be able to get appropriate help. The help could be in psychotherapy, cognitive behavioral therapy. It could also be medication. So it is the specialist that will decide what you actually need, and then will now monitor your progress to get you back to good health. So that aspect is like the most important thing. So nobody should allow someone to continue to manifest symptoms of mental health disorder for a long time without getting help for the person. And no individual should continue to endure or manage himself without seeking help. So the hallmark is seek help at the earliest possible.
Okay. Thank you very much for that. So we appreciate you for coming on this one, sir. That's Dr. Tim of Obong University's Medical Clinic. Thank you so much, sir. We appreciate you.
You're welcome.